Glad to be here. And Doug, because this is kind of a prurient crowd, I can tell I'm going to go straight to the budgetary sex. There's a new director of the Congressional Budget Office, and the Republicans have directed him to apply what is known as dynamic scoring to estimates of new legislative proposals. There are some people, Democrats, who make the argument that this is corrupt and it's going to produce a fantasy land kind of projection. And there are other people who think, well, of course, policies have effects on the world and we ought to try to account for those. Which is right?
My view of this has always been that it's very useful for CBO and for the staff of the Joint Committee on Taxation to provide estimates for the Congress of the macroeconomic effects of significant changes in fiscal policy and of the budgetary feedback from those macroeconomic effects. Mm-hmm. My own preference.
And you had been doing that.
And CBO has been doing that, and JCT has been doing that as well. CBO has done this for the president's budget each year. We did this for alternative long-term paths for fiscal policy in the long-term budget outlook, and we did this for a collection of other proposals as they came along. My own preference is for that information to be provided separately from the basic cost estimates, mostly because that sort of analysis can only be done well for a handful of pieces of legislation in a year, given its complexity, and because that sort of analysis often takes longer. So I think it's better viewed separately from basic cost estimates. But having said that, I think including it in basic cost estimates, as the budget resolution requires this year, is a reasonable course of action. I think what's important to make sure that this sort of dynamic scoring really is useful for the Congress and for citizens in the country is that the following things be true. Number one, that CBO and JCT have to be allowed to use their own independent professional judgment in forming these estimates. And that's true for all parts of cost estimates, of course, and that has been the long-standing tradition, but it's especially important under these circumstances, given the controversy about including macroeconomic effects. I think the CBO and JCT need to lay out the methodologies that they use in estimating the effects of fiscal policy on the overall economy. And when I was at CBO, we wrote a collection of reports over a number of years spelling out the methodology. And that's important for outside analysts to be able to scrutinize it and to be sure that the methodology is consistent across proposals. But I think it really has to be up to CBO and JCT to draw on the professional research literature as they think most appropriate for pieces of legislation. I think a second thing that needs to happen is that CBO and JCT need to do these sorts of estimates for changes in spending policies as well as for changes in tax policies. We know that federal benefits and federal investments can affect the macroeconomy, can affect the labor supply and the capital stock and productivity in important ways. And to be sure that the Congress is getting comparable information on different sorts of proposals, these same techniques can and should be applied on the spending side. I think the third thing is this work should be done for only a handful of bills in a year. It's very important that the work be done right, and it's complicated. We need to make sure that the analysts at CBO and at JCT can focus on the complexities of legislation and really think that through. And the last thing I would say, the fourth thing I would say, is that I think it's an important complement to this increased focus on the effects of fiscal policies on the overall economy for CBO and JCT to also continue to expand their analysis of the distributional effects of significant changes in fiscal policies. Because members of Congress are often weighing not just the consequences of legislation for the overall economic pie, but also for the sizes of the pieces of the pie that are going to different people. And CBO and JCT have done work of that sort, but I think it's a very important complement to doing more analysis of the overall effects of fiscal policy to do more analysis of the distributional effects as well.
Well, so bottom line analysis, are you concerned that CBO is going to be transformed into a political tool, or are you confident that the way in which this new direction will be implemented is going to preserve the independence and value of CBO?
I do not think that CBO will be turned into a political tool. I think there's very widespread support on Capitol Hill, on both sides of the aisle, from both sides of the Hill, for CBO being a strong and independent provider of information to the Congress. There are a few people on the Hill who may not share that view, but they are in a very small minority. And I think the support of the Congress now for 40 years for CBO being a strong and independent estimator is continuing today. I do not think that tradition will change, but I do think that CBO and JCT and that the Congress need to be very careful as dynamic scoring unfolds to be sure that CBO and JCT are given the same, are treated in the same way that they've been traditionally in other aspects of their estimates.
Before I get to the budgetary present and future, a couple of other leftover issues from your time at CBO. There's a major case, as you know, before the Supreme Court that is founded on the argument that the language of the Affordable Care Act prohibits the federal government on exchanges it established and operates from paying subsidies. It has been argued persuasively to me, as someone who covered the healthcare debate at the time, that no one ever, whatever the wording of the statute and how you construe very narrowly that wording, that it was never the intention or understood to be the intention of anyone in Washington that those subsidies would be prohibited. And one of the pieces of evidence that seems compelling to me is that you never scored an Affordable Care Act without subsidies from federal exchanges. Do you believe it is entirely obvious that the intent of the statute was that those subsidies would be provided on federally established exchanges?
I'm not a lawyer, so I can't speak to the statute and I can't speak to what the Supreme Court ought to do from a legal perspective. But it was a common understanding on the Hill, again, on both sides of the Hill, on both sides of the aisle, in late 2009 and early 2010, that subsidies would be available through the federal exchange as well as through state exchanges. And I'm confident in saying that because, as you mentioned, CBO's analysis always worked under the view that subsidies would be available through the federal exchange. Our analysis was subject to a lot of very intense scrutiny and a lot of questions. And my colleagues and I could remember no occasion on which anybody asked why we were expecting subsidies to be paid in all states, regardless of whether they established their own exchanges or not. And if people had not had this common understanding about what the law was going to do at that time, then I'm sure we would have had a lot of questions about that aspect of our estimates.
And when you say common, is that another way of saying more or less universal? Everyone involved in the process had that understanding?
I didn't talk to everyone, but my colleagues and I talked to a lot of people with a lot of questions about nearly every aspect of the estimates that we did. And we wrote to Chairman Issa a few years ago that we could not remember anybody asking us questions about what would happen in the federal exchange different from what would happen in the state exchanges.
And then one other issue that has to do with the stimulus bill and the response to the economic situation that the administration and Congress found themselves in 2009, 2010. I'd say a core argument between the two parties over the last few years since President Obama took office is whether or not President Obama and his policies inhibited job growth and caused the deficit to expand. And I believe it is President Obama's belief that the money that was spent in the Recovery Act actually reduced future deficits by the economic effects that it had, and that we're seeing the results of that now. Do you think he is correct, and that the money that was laid out in the Affordable Care Act, which in the Recovery Act, which increased deficits in the short term, in fact was a deficit reduction measure viewed over a number of years because of the economic activity that it created?
So CBO has said a number of times, and this is a very widely shared view in the economics profession, that the Recovery Act spurred output and employment. There was more things being made and more people employed than would have been the case without the Recovery Act. And that extra economic growth in 2009 and 10 and 11, because of the Recovery Act, did lead to additional tax revenue. But I think there's a very widespread view in the economics profession that that would not lead to enough additional tax revenue to offset the costs of the act. Now, over time, I don't think that the Recovery Act is boosting the economy, say later in this decade or beyond.
No effect on the economy right
There
now.
are some cross currents here. So the Recovery Act created some investments in infrastructure and other things. That's good for the economy in the long run. But the Recovery Act also involved a lot of federal borrowing, which I think in the long run will crowd out some private investment. So it's hard to predict how those effects will balance. But my assessment, and this was CBO's assessment, was there would not be a significant effect on output in the long run, certainly not a significant boost in output in the long run.
Okay, so let's get to the present.
As I said, there's often the trade-off in short-term fiscal stimulus. It is often, generally the case, that sort of extra spending or reduction in taxes when the economy is weak will be good for the economy in the short term. But unless there are offsetting changes in fiscal policy later to pay for that lower taxes or higher spending, then there'll be a drag in the long term.
Give us your assessment of the severity of our problem with deficits, near term, medium term, long term, compared with other points in your career in Washington. Because we've seen it's coming down, and the question is, where does that leave us right now? Are we in a severe deficit problem? Are we in a shrinking deficit problem? What is your assessment?
So our federal budget problems are very serious ones. Remember that for almost all of the periods since the Second World War, federal debt has been between about 1.25% and 1/2 of GDP. It is now at about 75% of GDP, and under CBO's projections for current law, it will pass 100% of GDP in 25 years. That is a very serious problem for our economic future.
Are you persuaded by studies that look at particular points on debt to GDP ratio and say that's too far, that leads to decline and ruin?
I don't think economists can identify a tipping point in the ratio of debt to GDP, in part because the effects of debt on GDP depend on many other characteristics of the economy, and in part because we don't have a lot of experience with debt at the levels that debt now is in the United States, so there isn't much evidence to draw on. So I don't think it's a matter of a particular line we can't cross. I think the consequences of higher debt are somewhat predictable and in some ways unpredictable, and both are worrisome. So higher debt in the long run reduces our capacity to do productive private investments, and that's a drag on productivity and thus a drag on people's incomes. I think that's predictable, although quantifying it precisely is hard. What's unpredictable is how high debt might prevent us from reacting to future challenges, domestic economic problems, international issues. When we went into this last financial crisis and severe recession, debt was 35% or so of GDP. We had room to let deficits expand and to have policies that expanded deficits further in 2009 and 2010. And that was very important in preventing the recession from being worse, even worse than it was. If we entered another similar sort of crisis with debt already at 75% of GDP, we would have much less room to maneuver. So I think there are very good reasons to worry about high levels of debt without identifying some particular point as a threshold that we cannot cross.
Well, let me go back to the deficit and just try to put it in a more concrete term. We've had periods of high deficits in what were then thought to be high deficits, late Carter administration, mid-'80s after Reagan tax cuts, early '90s before the Clinton tax increases, had a budgetary surplus and then deficits again, and they got very big in 2008, 2009. Given where we are right now, should the country's reaction be chill, moderately freaked out, or really freaked out?
I don't think that freaking out is a very constructive response. But I think people should be concerned enough to support changes in policy that would bring down the trajectory of debt relative to GDP. We don't have to balance the budget literally, but we do want, I think, debt to be on a downward trajectory relative to GDP from its current high level, rather than the upward trajectory that it's now on. And remember, the underlying drivers here are not not mysterious in any way. They were identified by economists and budget analysts many years ago. We have a population that is aging. More and more Americans are over the age of 65. A larger share of the American population is over the age of 65. And the federal government devotes a large share of its resources to providing benefits for older Americans. Healthcare costs are rising, not as rapidly as they were at some points in the past, but still rising. And the federal government devotes a large share of its spending to subsidizing health insurance, partly through new things like the Affordable Care Act, but of course partly through Medicare, partly through a tax subsidy for employer-provided insurance. So the aging of the population and the rising costs of health care are the fundamental driving factors. And what that means is that we can't go back to some set of budget policies we had before, because the pieces won't add up anymore. We will need to either cut back on programs for older Americans, programs focused on health care, or we'll need to raise revenues more than we've been used to in the past, or we'll need to greatly reduce the size of the federal government's other operations. But that third thing is actually already in current law. So because of the caps on discretionary funding, federal discretionary spending, the part that's appropriated each year, is on track to be much smaller relative to the size of the economy than it's been at any point in my lifetime, which is as far back as we have those data. And the federal investments that Mayor Bloomberg spoke about and some people on the video spoke about, those federal investments come almost entirely, the non-defense investments come almost entirely from non-defense discretionary spending. So that spending will be in a few years less relative to the size of the economy than at any point in my lifetime. That's not a forward-looking policy, and that's current law. That's already in these projections. If we tried to address the budget imbalance by further cuts, that would make that problem even worse.
So from a psychic, emotional standpoint, we do not need to sprint, claw, climb over each other to get out of the burning theater. We can walk briskly toward the exits.
Which is, in fact, the best way out of a burning theater, as we've all learned.
Let me ask you about the two big middle-class entitlement programs, Social Security and Medicare. First of all, true or false? It is often asserted, especially by people on the left, Social Security should not be part of the fiscal discussion because it is an independent program that contributes nothing to the deficit. True or false?
So I disagree with that. Social Security
that means false, right?
Social Security.
Disagree means false.
I think that's false.
Yes, okay.
I think it's false because, I mean, the first part is true. Social Security is an independent program, and there are separate calculations made of its financial situation. But I think the broader point is false because Social Security is a federal program, and its finances are part of the overall finances of the federal government. And I think it is most useful for the Congress and for citizens to think about all the federal government together. And I think that ring fencing particular programs, even if they have separate sorts of accounting mechanisms, is not the best way to look at fiscal policy.
Okay, another true or false question. The financial imbalance that Social Security faces can be pretty easily solved with a few nips and tucks here and there in the eligibility age, in the inflation escalator, change CPI, in changes that you can make to the benefits of high-income retirees, and a relatively painless tweak in the cap on money that's available for taxation on Social Security.
So I think that's false also. I think it is true that the Social Security imbalance can be addressed with some set of the changes that you described.
Yeah.
But I think whether those are nips and tucks and relatively painless is very much in the eye of the beholder.
Right.
I think the changes we need in fiscal policy are not large relative to the
So you think of that as a hard problem, not an easy problem. I remember early in the administration talking to Judd Gregg, who was at that time ranking on budget. He said, it's easy. We all know what to do. Not that big a deal. Do a little of this, a little of that. We get there. You think it's not easy?
Certainly, politically, it is a hard problem. I think it is an easier problem in a substantive sense than addressing the rapid growth of healthcare spending, because
It's more linear and simpler.
it's just about dollars. It's just about changing the collections and the flows of dollars. So substantively, it is more straightforward than trying to influence the operation of our healthcare system. But that doesn't mean it's easy politically to raise anybody's taxes or cut anybody's benefits, and that's what this comes down to.
Okay, let's talk about Medicare for a second. Healthcare costs have moderated in recent years, so I'm going to ask you two true or false questions. First, the moderation in healthcare costs that we've seen over the last few years has nothing to do with the Affordable Care Act, and it has mostly to do with what's happened with prescription drugs and generic drugs and drugs coming off of patent and therefore being cheaper.
So that's false. I think most of what has happened to Medicare spending is changes in the healthcare delivery system. Prescription drugs are part of that, but a lot is what's happening at hospitals and in doctors' offices and so on. CBO did a detailed analysis a few years ago of the sources of the slowdown in Medicare spending, and the slowdown really is across the board in almost every piece of Medicare, and for beneficiaries who are expensive and beneficiaries don't spend much money and so on. So it's a very broad-based slowdown that I think mostly reflects changes in the healthcare delivery system. Whether the Affordable Care Act has played a role or not, we don't know. I think there are some specific areas.
You don't think we know enough even to say that the role that the Affordable Care Act played in enhancing the signaling of those changes that you mentioned, we don't know enough to ascribe any of the reduction to that effect?
Some of that slowdown maybe
because the
due to Affordable
administration's
Care Act,
argument, as you know, is that the healthcare industry sees which way the wind is blowing. The Affordable Care Act helped blow the wind in that direction, and therefore that is fueling this slowdown.
So I think that is a plausible story, but I don't think we have evidence for that. Beyond a few specific areas, we can look at changes in hospital readmissions, for example, where there was a distinct change in policy in the Affordable Care Act, and one can look at a distinct change in the number of readmissions. So I think there's some specific areas where we can make that connection. But whether the broader change in how patients are being treated is attributable to the story that you described or to other factors, I think we do not know.
Well, okay, so whether or not we know the answer to that question, another true or false question. Based on the evidence that we've gotten for the last few years, we can be reasonably confident that the slowdown in healthcare inflation will persist. True or false?
We can be reasonably confident that it will persist for a while.
That is a true.
That is a true, but for a while. I want to be careful here because people...
Short-term true.
Short-term true, because people would often ask us at CBO whether certain changes in policies would bend the curve of healthcare costs. And they tended to mean that over a very long period of time. And I don't think we know that for what we've seen in the past several years. But I do think the slowdown we've seen in the past several years has been pervasive enough in the healthcare system. It's not just in Medicare. We've also seen slowdowns in Medicaid costs and in private insurance costs. It's been pervasive enough and has lasted long enough that I think we can have high confidence that it reflects real structural changes that will persist to some degree. But how long that will persist for, I think is, again, very, very hard to know.
Related question as we look to the future, and it has to do with Medicare reform, because obviously Medicare, you said it's a more complex budgetary challenge, and everyone's trying to figure out, how much are trends going to help us with Medicare, and what else do we need to do? One of the things that Paul Ryan and Mitt Romney, well, more Ryan, talked about in 2012 was the system known as premium support, which Alice Rivlin, who is a major part of this enterprise and its mission, was an advocate of, which involves, instead of having an open-ended fee-for-service system, you give a certain amount of money to Medicare recipients and let them shop on exchanges to buy insurance. And the argument is that market forces there will have a moderating effect on cost. The Obama administration went very hard against that, said it was a transfer of risk from the government to beneficiaries who couldn't bear that risk or shouldn't bear that risk. But I wonder if, in fact, the Affordable Care Act is having a signaling effect on the healthcare industry that has a salutary effect on costs, why wouldn't premium support have that same benefit? And depending on what you set the level of the voucher, you might not, you might produce benefit to the system in excess of the hardship on individual people assuming risk. What do you think about that?
I think the devil's in the details on a premium support system. I think there are
Meaning the size of the voucher, and the escalator in the voucher.
The size of the voucher to start with, how quickly the voucher increases in amount over time, and also the rules that are in place, the way the competitive market would be structured, that matter a tremendous amount. I think there are ways to design a premium support system that would have the advantages you suggest of using the competition between private providers of insurance with beneficiaries having real skin in the game and looking for less expensive policies. I think there are ways to take advantage of those forces to bring down overall healthcare spending. And I think that can be done in ways that protect beneficiaries from bearing too much cost out of pocket.
So
analytically, too much risk. But there are also ways to do it that would subject those beneficiaries to very large costs
Sure.
and significant
You
risk.
set it low. You set it low enough, you're going to transfer a lot of cost. Well, so analytically, you like that as a sort of core potential reform to the system that could be effective over the long run.
I think it could be effective if done right, but I want to be careful because I think people will sometimes take a label and attach it to policies with very different sorts of effects.
You're not talking about the media, are you? Media does.
Not you, personally.
Thank you. Thank you.
So I want to be very careful about this because I really do think, so the versions of premium support that Alice Rivlin
Does that mean you don't like this little
supports-
binary true-false game?
Yeah, well, not so much.
Yeah.
I think the versions of premium support that Alice Rivlin supports and the versions that Paul Ryan talks about much of the time are really quite different. So I want to avoid attaching my support for any generic version. But I do think there are versions of premium support that could be very effective and that I would support. But there are other versions that I would think were transferring far too much burden and risk to beneficiaries.
Let me go back to the issue of investments. The administration is now arguing, as part of its middle-class economic philosophy, that this government ought to be making large investments in human capital and future economic growth through the education system, through job training and apprenticeships, through infrastructure. Having examined the effects of government spending in various ways, are those compelling arguments to you in terms of let's leave aside the question of whether we can afford the spending or how we afford the spending. Is it your conclusion that the investments of the kind that I just mentioned will, in fact, produce economic gains, reduce income inequality, raise middle-class wages?
I think that's a powerful case for more investments. I think it's also true that the return to government investments varies tremendously across investments, that there are some highways that are crucially important, and there are bridges to nowhere. So I think that we should do more investments at the federal level.
But nothing in Alaska.
And some in Alaska. But I think we should do more investments, and we should also look for ways to make sure that the investments are having the greatest bang for the buck. Mayor Bloomberg referred to infrastructure bank having an advantage possibly of ensuring that projects are chosen more through their economic merit than through their political forces. I think that's the sort of thing we need to work on. I think there is a lot of research being done about ways to make training programs more or less effective. But I think that we need to make sure that we are getting the maximum benefit out of those investments. But I think there is compelling evidence that more federal investments would boost output and incomes in the long run, and that certain sorts of investments would particularly boost boost the incomes of people at the lower end of the economic ladder. And they have Those people have not shared very much in the gains in overall income that we've seen over the past few decades. I think that's why policymakers are particularly concerned about that.
Is it obvious to you, as a matter of analysis, the optimum way to finance those investments without impeding economic growth?
Well, in the short term, greater federal investment with money that is just borrowed would be good for the economy.
Larry Summers makes the case that we ought to, at interest rates this low, we ought to borrow a ton of money to invest in infrastructure, something like double or triple what the administration is talking about right now.
So I think, so I would disagree with that. I think, in the short term, additional infrastructure spending, additional federal investments of all sorts, using borrowed money.
I wish Larry was here to get that right in the face.
Would be good for the economy, because we have a lot of unemployed workers still, people who can't find jobs or can't find full-time jobs. And monetary policy is trying to boost the economy, but fiscal policy has been a headwind for the past few years. This reduction in deficits has slowed the economic recovery. But the harder issue, the one that Larry is pressing on, is whether in the longer term we can borrow money for infrastructure investment and have that be good for the economy. And I'm not persuaded, at least at this point, by that argument. It is true that interest rates for federal borrowing in particular are quite low now. I did some research 20 years ago with Greg Mankiw and Larry Ball, in which we noted that interest rates on Treasury debt had been below the growth rate of the economy for most of the post-war period. And that meant that in many cases, one could accumulate debt, and if one then balanced the budget apart from interest payments on the debt, balanced the rest of the budget, that over time, with interest rates below the growth rate of the economy, debt would tend to come down relative to the size of GDP. But we also noted that that was not guaranteed, that if one encountered an unfortunate state of the world in which economic growth fell short or interest rates moved up, then you would have to address the looming debt problems. And that would be a condition, perhaps, with lower economic growth, where it was particularly unpleasant to do. So the fact that interest rates are low now, that helps us in being able to address the budget challenge more slowly, but it doesn't, it's truly as a gamble. The name of our paper was a deficit gamble. It is a gamble to borrow an expectation you don't have to pay it back.
Okay, so however unwelcome this would be to Larry, let's assume he's wrong and Doug is right. So then the question is, do you finance these investments, which you think will pay off, by reducing other spending, or, and I realize they're not mutually exclusive, but for purposes of thinking about it, or by raising revenue? Is that answer obvious to you?
Very few answers are obvious to me. I think these are hard problems.
Don't be so modest.
I think if we're, I think the way we need to make decisions about fiscal policy is to step back and realize that fiscal policy is not an end in itself. It's a means to ends. So we have to ask what we view as the biggest economic and social problems the country faces, and how fiscal policy can help address those problems, or at least not make those problems worse in some cases. So if you think the biggest economic problems we face are, and this is my own personal list, in the short term, still an important shortfall of jobs for people who want them, then that suggests that fiscal policy should, in the short term, be more expansionary. So we should
Our
borrow
deficits
money
right now should be bigger than they are right now.
to boost the economy now, yes. But if one thinks the second big problem the country faces is over the longer term, we have slow productivity growth, and that's leading to slow growth of output and income, then we want to do things to boost productivity growth over the long term. And that means reducing federal debt over the long term to create more room for private investments. And it means boosting federal investments. So we have both private and public investment moving in the same direction.
By the way, some Republican staffer on Capitol Hill is probably tweeting right now, Elmendorf endorses higher deficits. Good thing we got a new CBO director.
Perhaps. I think nothing I'm saying today actually is different from what I said as CBO director. And I think what I said then was based on the analysis that my colleagues and I did. So I think I'm being less novel perhaps than you're suggesting. I think the third issue that I see, the third big economic problem I think we face is that people in the lower and middle incomes have not experienced gains in income like people on the top of the income distribution for a number of decades now. And I think that suggests that when we take actions to reduce budget deficits or bring down debt over the long run, that from my perspective, we should look for ways to do that that don't impose burden on people at the lower middle income levels. And that's where you get to the question then of what changes in spending policy and what changes in tax policy one would want to
here's one reason the question is raised. There's one view that says the obvious place to get money for investments is is essentially a generational trade. You go to Social Security and Medicare, the big middle class entitlement programs. We're spending too much on those. They're contributing to our imbalance. Money should come out of those. And there's another that says, no, we've got room to raise taxes and produce more revenue without harming the economy. I had an interview last night with Bernie Sanders, who's running for president, probably not on the Peterson Foundation platform. And he said, look, when Dwight Eisenhower was president, we had taxes on the most affluent of 90% at some income levels. There's nothing intrinsically wrong with that. As you think about where we could, without having counterproductive effects, get more money, do you think that there is significant room, given the affluence and the shift in income we've seen toward people at the top, to get money there to finance some of these investments without hurting the economy?
Well, I think Senator Sanders would talk about his concern about overall economic growth and also his concern about the distribution of the fruits of that growth. And both those factors matter for making tax policy. I think the important lesson here is that there are more and less efficient ways to raise additional revenue. Raising tax rates would generally be less efficient than other things that we can do. So for example, tax expenditures, these are special provisions of the tax code that amount to federal spending in terms of directing resources of particular people for particular purposes.
Mortgage interest deductions.
The mortgage interest deduction, the treatment of health insurance purchases by employers. Those tax expenditures are very large, $1.5 trillion this year across the individual payroll tax and corporate income tax. If one scales back some of those tax expenditures, that would have very small negative effects on efficiency or perhaps positive effects on efficiency.
So would you prefer to take a particular choice the administration has made, rather than raise the top tax rate for the highest income levels, you would rather lower the rate at which they can claim deductions, as the administration has proposed?
That would be a more efficient way to raise revenues, yes.
All right, I'm going to close with a question from iPad. We have a live streaming audience, and Kyle Bazenko from St. Paul, Minnesota, puts this question to you, Doug. What is the most important concept for everyday citizens to understand to more accurately analyze and assess the U.S. budget situation and fiscal options we face?
I think the most important concept, really the most important concept in economics, is opportunity cost, which is that if you want to do something, then you're giving something up to do that. You're using your time to be here rather than being somewhere else. You're using federal money, your taxpayers' money, for some purpose rather than some other purpose. And so there are trade-offs. And we can't pretend that there aren't. We need to confront them. And we need to recognize that various objectives we like receiving more in government benefits and services and paying less in taxes, that you can't have everything you want, that there are choices to be made. And I think in some ways the root of our fiscal problem today is that we have not made those choices. Members of Congress have not made those choices, and we as citizens have not made those choices because we have not come to terms with the trade-off, with the opportunity cost of providing more in benefits or having lower taxes. And that's the concept that people should focus on as they listen to these kinds of discussions.
So you're leading me to my last true or false question. Washington, politics, and the politicians here are really, really, really bad at opportunity cost and trade-offs.
The people are really bad at opportunity costs and trade-offs. And our elected officials, I think, are reflecting the difficulty that we as citizens have making those choices.
Wait, so you're saying that politicians are not, in fact, worse than regular people?
I think
That is novel.
politicians are not worse than regular people. They are much
False.
like regular people, in my experience.
Even though they're not regular people.
They are reflecting, I think,
Similar to regular people.
they're reflecting, they are regular people, but they're also reflecting in their own views, but they're also reflecting the views of their constituents. And I think their constituents maybe the people in this room are more of an exception to this, but I think their constituents have not shown a willingness to live with those trade-offs.
Okay, well, Doug Elmendorf is not a regular person. He's an exceptional person. Would you join me in thanking him for